listen closely, because what I'm about to tell you could save your life. Most people never think twice about how they sleep at night. But as a brain doctor, I'm shocked to see how a simple sleeping position, something you do every single night, can silently raise your risk of a stroke while you sleep. It's not about how long you sleep. It's how you position your body. This overlooked detail can mean the difference between waking up refreshed or facing a devastating health crisis. Sleeping on your back with your head slightly elevated is one of the most overlooked, yet powerful ways to support brain health and reduce stroke risk. Many people assume that if they get enough hours of sleep, they are doing their brain a favor, but the truth is that the quality and position of your sleep are just as important as the quantity. When you lie flat on your back, your head and neck are often in a straight horizontal line with the rest of your body, which might feel natural at first. However, lying completely flat can allow blood to pool or increase pressure inside the brain's delicate vessels, especially in older adults or in those with hypertension. By simply elevating the head about 10 to 15 degrees, you create a gentle angle that allows gravity to assist in the drainage of venous blood away from the brain. This slight incline reduces intracranial pressure, eases the workload on the heart, and ensures smoother blood flow throughout the night. When you sleep flat, there can be subtle restrictions in circulation because the neck and veins have to work against gravity to keep the brain's blood flow steady. Overnight, as your body relaxes and your heart rate slows, circulation can become more sluggish. If you already have issues like atherosclerosis, high blood pressure, or even just mild stiffness in your neck arteries, sleeping completely flat can compound those problems. That slow, sometimes stagnant blood flow makes it easier for small clots to form or for plaques to become unstable. These are exactly the conditions that can increase the risk of a stroke. Elevating your head by just a few inches shifts the dynamics of blood movement. Gravity helps keep the pathways more open and supports the natural drainage of blood and cerebrospinal fluid, which is particularly important because the brain's glymphatic system does most of its cleanup work while you sleep. The head and neck position also matter for the health of your spine and the arteries running along it. When your head is propped at a gentle incline with proper pillow support, the cervical spine remains in a neutral, relaxed curve, which reduces mechanical pressure on the vertebral arteries. These arteries pass through small bony canals in the neck and supply blood to vital parts of the brain, including the brainstem and cerebellum. When they are kinked or compressed because of a poor sleeping posture, even slightly, the flow can be compromised over hours of the night. A neutral alignment that comes from slight elevation prevents that subtle but chronic stress and preserves smooth delivery of oxygen-rich blood. People often underestimate how much fluid dynamics matter in stroke prevention. Your body is not a rigid system. Blood and cerebrospinal fluid are constantly circulating. When you lie flat, especially if you have congestion, fluid can accumulate in the head and neck area. This congestion can increase venous pressure and, over time, put stress on fragile vessels in the brain. It can also interfere with the brain's waste clearing processes. The glymphatic system, which acts like a nighttime cleansing network, depends on rhythmic pulses of cerebrospinal fluid to flush out toxins and metabolic debris. If drainage is slowed because of poor positioning, that waste can build up, contributing not only to inflammation and vascular risk, but also to long-term neurodegenerative changes. A slightly elevated head position optimizes the gentle pressure gradient needed for this waste clearance to flow efficiently. Furthermore, sleeping on your back with your head raised is particularly helpful for people who snore or have mild sleep apnea. These conditions, characterized by pauses or reductions in breathing during sleep, are significant yet often hidden contributors to stroke risk. When you elevate your head, you open up the upper airway and reduce the likelihood of the tongue and soft tissues collapsing backward to block airflow. Better breathing during sleep translates into more stable oxygen levels, less strain on the cardiovascular system, and reduced nighttime spikes in blood pressure, all of which protect the delicate vessels in your brain. Many individuals also suffer from acid reflux without realizing how it can affect vascular health. Lying flat can exacerbate reflux, which in turn can cause subtle nighttime inflammation, raise stress hormone levels, and disrupt sleep quality. When you sleep with your head slightly elevated, gravity again helps by keeping stomach acid down, improving comfort, and allowing the body to enter deeper, more restorative stages of sleep. High-quality, uninterrupted sleep is essential because it allows the brain to go through the natural cycles that regulate blood vessel tone and repair. Poor sleep increases cortisol and other stress markers that can make blood vessels more vulnerable to damage, while deep, consistent rest strengthens them. Implementing this adjustment does not require complex equipment. A simple wedge pillow or a modest incline created by adjusting your bed frame can make a profound difference. It's important to remember that elevation should be subtle. Raising the head too much can lead to neck strain or discomfort, and may even impede circulation. The goal is to achieve a gentle incline, enough to aid gravity without causing tension. It can take a few nights to adjust to this new position, but most people find that once they do, they sleep more comfortably and wake up feeling clearer and more refreshed. Another often overlooked benefit of this sleeping position is its positive effect on lymphatic drainage in the head and neck region. While not as widely discussed as blood circulation, lymphatic flow also plays a role in reducing inflammation and maintaining healthy tissue in the brain and surrounding areas. The lymphatic system has no pump of its own and relies on body movements and gentle pressure gradients. Elevating the head encourages lymph to drain downwards more effectively, further reducing swelling and vascular stress in the brain. It is also worth emphasizing that prevention is always more powerful than treatment when it comes to strokes. Many people only learn about the importance of sleep posture after they have already experienced warning signs such as transient ischemic attacks or minor vascular events. By adopting a slightly elevated back sleeping position early, especially for individuals with high blood pressure, diabetes, obesity, or a family history of stroke, you can reduce one of the silent contributors to this devastating condition. In summary, sleeping on your back with a slight elevation of the head creates an environment that supports the brain's circulation, protects fragile blood vessels, optimizes the natural waste clearing systems, improves breathing, and even reduces other risk factors such as reflux and inflammation. This is a simple, accessible intervention that requires no medication and no expensive technology. It's a small change in habit that yields significant protective effects over time. For something as crucial as brain health, making this adjustment is not just wise, it's essential. Every night spent in the right position is a night your brain is better protected from the hidden dangers that accumulate over years. Sleeping on your stomach is one of the most harmful positions for your brain and your overall vascular health, yet many people unconsciously adopt it because they find it comforting or because it feels like a natural way to drift off. What most people don't realize is that this habit puts the neck and head in a severely compromised position for hours at a time. The neck must be turned sharply to one side in order to breathe, and this unnatural twist can compress the carotid arteries on the side to which the head is turned. These arteries are the main highways carrying oxygen-rich blood from the heart to the brain. Even a slight reduction in their diameter over the course of several hours can decrease the amount of blood flowing to critical areas of the brain. The vertebral arteries, which pass through the vertebrae of the neck and also supply vital regions of the brain, are similarly at risk of being pinched or kinked when the neck is rotated for prolonged periods. This subtle but chronic impairment in blood delivery creates conditions where clots are more likely to form and where already vulnerable blood vessels can become damaged over time. The human body is designed for symmetry, especially when it comes to circulation and nervous system function. When you lie face down with your head forced to one side, you break that symmetry. Blood flows more freely through one side of the neck while being restricted on the other, and this uneven circulation can lead to localized pressure differences. The tissues that line the blood vessels, known as the endothelium, respond poorly to these abnormal stresses. They can become inflamed, and when inflammation takes hold in the vascular system, the risk of plaque formation and clot development rises sharply. Over many nights, what seems like an innocent preference for stomach sleeping can actually increase the wear and tear on these vital arteries, leaving them less resilient to fluctuations in blood pressure and more prone to injury. Another significant danger of stomach sleeping is the impact it has on spinal alignment. The cervical spine, which houses not just the vertebral arteries, but also many important nerves, is designed to maintain a gentle forward curve when the body is in a neutral position. Twisting the neck sideways for hours at a time flattens or distorts this curve, putting mechanical strain on the joints and soft tissues. This can lead to chronic tension and stiffness, but more importantly, it can put additional pressure on the blood vessels that travel alongside and through these structures. When the neck muscles are tight or the joints are compressed, the space available for arteries to pass through becomes narrower. Over time, these subtle compressive forces can contribute to reduced blood flow and even microtrauma to the vessels, which increases stroke risk. Breathing can also be compromised when you sleep on your stomach. The chest is pressed into the mattress, restricting the natural expansion of the lungs. Many people who sleep face down end up tilting their head at awkward angles or burying part of their face into the pillow, which can increase airway resistance and reduce oxygen intake during sleep. The combination of lower oxygen levels and impaired blood flow to the brain is a dangerous recipe for vascular health. The brain is an oxygen-hungry organ. It uses about 20% of the body's oxygen, even though it represents only a small fraction of body weight. Any chronic reduction in the oxygen supply forces blood vessels to dilate and work harder, increasing stress on their walls. For individuals with pre-existing cardiovascular issues such as hypertension or plaque buildup, this added stress heightens the chance that a clot or vessel rupture could occur. Many people underestimate the effects of repeated nightly postural stress. You might not feel anything obvious when you wake up from sleeping on your stomach, perhaps just a stiff neck or mild shoulder pain. But inside the body, the nightly cycle of compression, reduced circulation, and increased pressure on delicate vessels adds up. Blood clots rarely form spontaneously. They develop in environments where blood flow is slow or turbulent, and where vessel walls are injured or inflamed. Stomach sleeping creates exactly those conditions: restricted flow, mechanical stress, and inflammation over time. This is particularly risky in older adults whose vessels are already less elastic and more vulnerable. Another critical consideration is how this position interferes with the brain's own self cleaning mechanism, the glymphatic system. This network works best when the neck and spine are in a relatively neutral position and when circulation and cerebrospinal fluid flow are unimpeded. Sleeping face down can hinder this flow by putting undue pressure on the neck and upper torso. When waste products such as beta, amyloid, and other inflammatory molecules are not efficiently cleared, they accumulate and contribute to chronic inflammation and oxidative stress within the brain's blood vessels. This chronic stress can gradually weaken the vessels, increasing their susceptibility to rupture or blockage. Acid reflux and abdominal pressure can also worsen in the stomach sleeping posture, which might not seem directly related to stroke risk at first. However, reflux often triggers micro-arousals at night that fragment sleep and raise stress hormones like cortisol. Elevated cortisol levels contribute to higher nighttime blood pressure, which is another major risk factor for strokes. Furthermore, the chronic low-grade stress of disrupted sleep impairs the body's ability to repair blood vessels and maintain healthy endothelial function. Thus, the stomach position contributes to a cascade of indirect factors that, taken together, increase the likelihood of vascular events. Some individuals might argue that they have slept on their stomachs for years without problems. While this might be true for younger people with flexible arteries and robust circulation, the risks rise substantially with age, weight gain, or the onset of conditions like hypertension, diabetes, or sleep apnea. Even if no immediate symptoms appear, the cumulative effect of decades spent in this posture can catch up in the form of silent vascular damage. This is why many neurologists and sleep specialists advise shifting away from stomach sleeping, especially for those in midlife and beyond. Transitioning out of a stomach sleeping habit can be challenging because the body often defaults to its most familiar position during sleep. However, using supportive pillows to encourage side or back sleeping, choosing a slightly firmer mattress to prevent the torso from sinking, and practicing better sleep hygiene can help train the body to adopt healthier positions. Sometimes even a modest adjustment, such as starting the night on your side with a pillow supporting your back, can reduce the amount of time spent face down. Over time, these small changes lower the mechanical and vascular stresses that stomach sleeping imposes. In the end, the danger of sleeping on your stomach lies in the way it silently compromises the two main factors that protect the brain's steady, unobstructed blood flow and low, consistent pressure in the vessels. By twisting the neck, compressing arteries, restricting breathing, and interfering with the brain's cleaning systems, this position stacks multiple risks against you. Unlike diet or exercise habits, which require active effort during the day, changing sleep posture is a one-time adjustment that pays dividends every night. Recognizing and correcting this harmful position can significantly reduce a hidden source of stroke risk and improve overall brain health for years to come. Sleeping on your left side has emerged as one of the most beneficial positions for supporting not only overall health, but especially the long-term well-being of your brain. While many people choose their sleeping side based purely on comfort or habit, the side you pick has a profound impact on how your body circulates blood, removes waste, and regulates pressure throughout the night. The left side, in particular, offers a unique advantage because of the way it works with your body's natural anatomy, gravity, and the function of the brain's glymphatic system. This system, which acts like the brain's night-time janitor, is responsible for clearing out metabolic waste, excess proteins, and other toxins that can accumulate in the brain's tissues and blood vessels. When these waste products are not efficiently removed, they can contribute to chronic inflammation and damage to the vascular system, making the vessels more fragile and prone to blockage or rupture. Research has shown that side sleeping, especially on the left, enhances the circulation of cerebrospinal fluid and promotes the drainage of these wastes more effectively than sleeping on the back or stomach. This improved clearance reduces the stress on blood vessels and lowers the long-term risk of conditions such as stroke and neurodegenerative diseases. Another reason the left side sleeping position is so valuable is that it works harmoniously with the heart and venous system. The human circulatory system is asymmetrical. The largest vein that returns blood to the heart, the inferior vena cava, runs slightly to the right side of the spine. When you sleep on your left side, gravity helps keep this vein free from unnecessary pressure, allowing venous blood to return to the heart more efficiently. This in turn reduces the workload on the heart and promotes smoother circulation to the brain. In contrast, sleeping on the right side can sometimes compress this vein, slightly hindering blood flow and raising central venous pressure, particularly in people who already have cardiovascular challenges. By reducing resistance to venous return, left side sleeping helps maintain lower pressure in the brain's vessels overnight, a key factor in minimizing stroke risk. The position also alleviates pressure on certain vital organs and optimizes lymphatic drainage. The lymphatic system, like the glymphatic system in the brain, plays an essential role in clearing waste and excess fluid from tissues. While this system relies on movement and gentle pressure changes throughout the body, sleeping on the left side supports more efficient drainage from the lower extremities and abdominal organs, again, because of the natural orientation of these structures and the pull of gravity. Better lymphatic drainage reduces the burden on the circulatory system and supports healthier blood vessel walls. A well-functioning lymphatic system helps keep inflammation in check, which is crucial because chronic inflammation is a known contributor to vascular damage and stroke. Many people do not realize that the position they sleep in can influence their breathing and airway stability. Left side sleeping has been shown to help reduce snoring and mild obstructive sleep apnea in some individuals. When you sleep on your back, the tongue and soft tissues of the throat are more likely to fall backward due to gravity, narrowing the airway and leading to pauses in breathing or snoring. These interruptions in breathing, even if they are brief, can cause fluctuations in blood oxygen levels and raise blood pressure, both of which are harmful to the delicate blood vessels in the brain. By sleeping on the left side, the airway often remains more open, leading to steadier breathing and better oxygen delivery throughout the night. Improved breathing supports stable cardiovascular function, which in turn protects the brain's vascular health. An often overlooked benefit of left side sleeping is the way it interacts with digestion and reduces nighttime reflux. The stomach and pancreas are located primarily on the left side of the body. When you sleep on your left side, the natural curve of the stomach allows it to rest below the esophagus, reducing the likelihood of acid reflux. In contrast, lying on the right side can position the stomach higher than the esophagus, making it easier for stomach contents to move upward and cause irritation. Acid reflux not only disrupts sleep, but also triggers stress responses that can elevate blood pressure during the night. By minimizing reflux, left side sleeping promotes deeper, more restorative sleep cycles, which are essential for vascular repair and the regulation of hormones that affect blood pressure and inflammation. Left side sleeping also aids the brain's nightly detoxification by working with the natural ebb and flow of cerebrospinal fluid. During sleep, the brain cells shrink slightly, allowing more space for this fluid to wash through and remove waste. This process is most active during deep sleep, and proper positioning can enhance its efficiency because of how the brain's venous outflow and lymphatic, like drainage pathways, are situated. Side sleeping, particularly on the left, seems to create the least resistance to fluid movement. Over the years, this enhanced clearance can help prevent the accumulation of plaques and other harmful substances that damage blood vessels and raise stroke risk. Another crucial factor is the reduction of pressure on the heart when sleeping on the left side. The heart lies slightly to the left in the chest, and when you sleep on the left, gravity allows it to sit more naturally in its cavity without being compressed by other organs. This can ease cardiac workload during sleep, especially in individuals with certain types of heart disease or high blood pressure. By reducing strain on the heart, blood pressure tends to remain more stable overnight, sparing the fragile vessels in the brain from harmful spikes that could trigger vascular injury. For individuals at higher risk of stroke, such as those with hypertension, diabetes, obesity, or a family history of cardiovascular disease, the benefits of adopting this sleeping posture are even more pronounced. It acts as a low-effort, passive form of prevention that works every single night without requiring pills, supplements, or costly devices. Adjusting to left-side sleeping can take time, especially for people accustomed to other positions, but using a supportive pillow between the knees or behind the back can make it more comfortable and encourage consistency. There is also a psychological component to consider. Knowing that something as simple as sleeping on your left side can make a measurable difference in your brain health can reduce anxiety about stroke risk and promote better overall sleep hygiene. The confidence that comes from making a small, proactive change often translates into adopting other healthy behaviors, such as maintaining a good diet, exercising regularly, and monitoring blood pressure, all of which synergistically reduce stroke risk. In the long run, left-side sleeping is a natural, non-invasive strategy that complements medical treatment and lifestyle changes aimed at protecting vascular health. It works by optimizing the forces of gravity, the anatomy of circulation, and the body's own cleansing systems to create a nightly environment where the brain and its blood vessels can function with less stress and more resilience. Over months and years, this seemingly minor habit can play a significant role in preserving cognitive function, reducing the likelihood of small vessel disease, and preventing the catastrophic events that strokes can bring. Embracing left-side sleeping is not just about comfort, it is about understanding the intricate ways our bodies are designed to function best and respecting that design to protect the brain. Every night spent in this position allows for better circulation, more efficient detoxification, less vascular strain, and deeper, more rejuvenating rest. In a world where stroke remains one of the leading causes of disability and death, making a conscious effort to adopt this optimal sleeping posture is a simple yet profound step toward long-term brain health. The role of proper pillow support in sleep health is often underestimated, yet it can make the difference between maintaining smooth, consistent blood flow to the brain and putting unnecessary strain on the delicate vessels that feed it. Many people assume that as long as they have a pillow under their head, they are adequately supported, but the reality is that the height, shape, and firmness of the pillow can significantly influence how your head and neck align during the hours you spend asleep. This alignment determines the openness of the airway, the freedom of the neck arteries, and the stability of venous return from the brain back to the heart. A pillow that is too high forces the head forward, bending the neck at an unnatural angle. This bend can partially compress the carotid and vertebral arteries and restrict blood flow, leading to increased vascular resistance in the brain. Similarly, a pillow that is too flat allows the head to fall backward, overextending the neck and placing stress on both the arteries and the cervical spine. Both scenarios disrupt the smooth circulation that the brain needs for overnight repair and detoxification and can, over time, contribute to higher stroke risk. When the neck is bent for long periods, whether forward or backward, it also interferes with the function of the lymphatic and glymphatic systems. These systems depend on unobstructed fluid movement through the soft tissues of the neck and head. Poor alignment can create pockets of congestion where waste removal is slowed, increasing the potential for inflammation in the vessels. Inflammation is one of the key contributors to vascular disease, as it weakens the walls of the blood vessels and makes them more prone to rupture or clot formation. A well-chosen pillow that supports the natural curve of the cervical spine keeps these pathways open, promoting effective fluid exchange and supporting the brain's nightly detoxification process. Another crucial factor is that improper pillow support often leads to muscle tension in the neck and shoulders. Tight muscles can press against the vertebral arteries that run through the bony channels of the neck, subtly reducing their diameter. This mechanical narrowing, especially when sustained throughout the night, can limit the amount of oxygenated blood reaching key parts of the brain. The brain is highly sensitive to even slight reductions in blood flow. Chronic low-level restriction can impair its resilience and set the stage for small vessel disease or transient ischemic attacks. In contrast, a pillow that provides just enough lift to maintain a neutral head and neck position allows these arteries to remain relaxed and open, helping to protect brain health. Pillow height and firmness should be tailored to an individual's preferred sleeping position. For back sleepers, a thinner pillow with a slight contour that supports the curve of the neck is ideal. This keeps the head from being pushed too far forward while maintaining a slight incline that aids venous drainage from the brain. For side sleepers, a thicker, firmer pillow is usually needed to fill the space between the shoulder and the head, ensuring the neck stays in line with the rest of the spine. Without this support, the head can tilt downward, causing compression on one side of the neck and stretching on the other, both of which can disturb circulation. By maintaining this neutral alignment, side sleepers can preserve healthy blood flow through the night and avoid the morning stiffness that often signals that the vessels and muscles were under strain. The materials used in a pillow also play a role in circulation and support. Memory foam or latex pillows that conform to the shape of the head and neck can provide even support without creating pressure points that restrict blood vessels. Traditional feather pillows, while soft and comfortable, often lose their shape during the night, causing the head to sink and the neck to bend awkwardly. Regularly adjusting or fluffing a pillow can create small positional changes that might disrupt sleep and reduce its restorative quality. Consistent, stable support ensures that the neck and head stay in a healthy position for the entire duration of sleep, allowing uninterrupted blood flow and optimal oxygen delivery to the brain. It is also important to recognize that pillow support affects more than just circulation. It influences breathing, which in turn impacts vascular health. If the neck is not properly supported, the airway can narrow or partially collapse, especially in people prone to snoring or mild sleep apnea. These breathing disruptions lead to repeated drops in blood oxygen levels and surges in blood pressure during the night, both of which stress the delicate blood vessels in the brain. A supportive pillow that maintains neutral neck alignment can help keep the airway open, encouraging steady breathing and preventing the harmful fluctuations in oxygen and blood pressure that increase stroke risk. Many individuals fail to replace their pillows often enough, using ones that have lost their supportive qualities. Over time, pillows can become compressed, lumpy, or uneven, forcing the head and neck into awkward positions that compromise circulation and strain the spine. Experts generally recommend replacing pillows every 1 to 2 years or sooner if they no longer maintain their shape. Keeping a pillow that is in good condition is a simple yet powerful step in safeguarding nightly vascular health. In addition to the pillow, under the head, strategic use of supplementary pillows can further support healthy alignment. For side sleepers, placing a pillow between the knees can prevent the spine from twisting and keep the hips aligned, which in turn supports even positioning of the upper body and neck. For back sleepers, a small pillow under the knees can reduce lower back strain, allowing the entire spine to rest in a neutral position and minimizing the likelihood that the head and neck will shift into a compromising posture during the night. These adjustments help maintain a balanced skeletal alignment that indirectly protects the blood vessels running through the spine and neck. Poor pillow support can also influence sleep quality and, by extension, the body's ability to regulate vascular health. When the neck is strained or circulation is restricted, people often toss and turn or wake up with discomfort. Fragmented sleep disrupts the deep stages when the brain performs its critical waste clearance and when blood pressure naturally dips to give vessels a rest. Chronic sleep fragmentation is linked with higher risks of hypertension and stroke. Therefore, a well-supported head and neck not only promote physical alignment, but also enable continuous, restorative sleep cycles that are crucial for vascular resilience. Temperature regulation, often overlooked, is another subtle way pillow choice can affect brain and vascular health. Some materials trap heat, which can cause night sweats and lead to micro-arousals that disrupt sleep. Certain modern pillows use cooling gel layers or breathable materials that help maintain a stable temperature, contributing to deeper and less interrupted rest. The calmer and more stable the sleep, the better the body can carry out the nightly processes that protect the brain's vessels. Perhaps the most profound advantage of proper pillow support is that it provides an effortless, passive form of care. Unlike dietary changes or exercise routines, which require conscious effort and discipline, once you have the right pillow and setup, you reap the benefits every night without further action. This simple environmental change reduces a risk factor that many people are unaware they even have: subtle, chronic vascular stress caused by improper head and neck positioning during sleep. In the broader context of stroke prevention, focusing on pillow support might seem like a small detail, yet it exemplifies how small, consistent actions can lead to significant long-term benefits. The brain's vascular network is sensitive to both mechanical and chemical stresses, and sleep posture is one of the few mechanical factors we can easily control. By choosing the right pillow and maintaining proper support, you create the best possible conditions for your blood vessels to function optimally throughout the night. Over years, this consistent care can reduce the wear and tear that contributes to vascular damage, lowering the likelihood of stroke and helping preserve cognitive health well into older age. In conclusion, a properly supportive pillow is not just a comfort accessory, but a vital component of vascular and brain health. It ensures the neck and head remain in a position that facilitates optimal blood and fluid circulation, reduces the mechanical strain that can damage vessels, improves breathing, and supports restorative sleep cycles. Investing in the right pillow and being mindful of how it supports your sleep position is a simple, yet powerful step toward protecting your brain from the silent risks that can accumulate over time.